Did you know that #WomenBleedToo? Women and girls can be affected by bleeding disorders such as haemophilia, von Willebrand disease, platelet disorders, and other factor deficiencies. Bleeding symptoms range from long-lasting bleeds after a cut or surgery, heavy nosebleeds over 10 minutes, excessive bleeding gums after a tooth extraction, family history of bleeding disorders, prolonged menstrual bleeds, frequent and/or large bruises, postpartum bleed, anemia, needing a transfusion. The most common bleeding symptom in women is long-lasting menstrual bleeding. The 7-2-1 rule helps identify heavy menstrual bleeding in 3 signs: bleeding lasting more than 7 days, the need to change a pad or tampon every 2 hours or less, clots larger in size than a €1 coin. Women and girls affected by bleeding disorders are typically diagnosed later than men and boys, meaning their condition is often neglected. This results in them not having the same level of treatment and care. The disruption to everyday life can impact women in all stages of life, from school to work to having a successful career, enjoying a fulfilling social and romantic life, or starting a family. A group of patients and medical experts from 2 European organisations came together in 2021 to develop a set of 10 core principles of care. These principles are a tool for patients, patient groups, family and healthcare professionals to advocate for and demand better healthcare services for women and girls with bleeding disorders. The principles call for equal availability and quality of treatment for all people with a bleeding disorder, early and accurate diagnosis of a bleeding disorder in girls and women, awareness of the additional difficulties caused by a bleeding disorder, family support from a comprehensive care centre, increase of gynecologists, obstetricians and midwives in multidisciplinary treatment teams, education for girls and women with bleeding disorders and their families about the menstrual cycle, early diagnosis and treatment of heavy menstrual bleeds, availability of pre-pregnancy counselling and prenatal diagnostics, providing patient-centred support and treatment before, during and after pregnancy, inclusion of girls and women with bleeding disorders in registries and research. We call on every patient and medical organisation providing care for people with haemophilia and other rare bleeding disorders to endorse these principles, adapt them as best practice, and advocate for improving their healthcare system. Encouragingly, we now have the tools to diagnose, treat, and care for these women and girls. Join us now in helping to raise awareness and demand better access to treatment, care, and research. To learn more about these principles, our work, and how you can make a difference, go to ehc.eu.